Hello, everyone. This is Dr. Cross. This is Chapter 2 from Introduction to Public Health, the fifth edition. Why is public health so controversial? There's a difference between social justice and market justice. And the differences between social justice and market justice is the common good. How do we consider the common good as well as individual responsibility? What is the common good when you're thinking about social justice, and what is the common good when you're thinking about market justice? When you're thinking about individual responsibility, what is the individual responsibility when it comes to social justice? And think about individual responsibility when you're talking about market justice. There is a market aspect to public health. When you think about how to assess, how to diagnose health concerns or public health conditions or issues, whether they're environmentally triggered or disease triggered, there's usually a price tag related to public health. And so there it has a market aspect to it. Sometimes there's questions about the scope of public health in terms of how far a reach, how much power in terms of do we provide public health in its pursuit and functions in keeping people healthy. There are also important economic factors for health, and so it can become politically controversial when you're thinking about public health. As social workers, we are oftentimes balancing social justice and market justice, with focus more on social justice. But we still have to understand market justice as well. When we think about what are some of the sources of controversy when we're thinking about public health, it does have an economic impact. What is the price tag? Think about COVID-19 specifically, since this is the current pandemic or the most current pandemic we have been experiencing. When you think about COVID-19, what has been the economic impact of that? And when you're thinking about trying to help or improve outcomes, what is the price tag? Based on your political values and beliefs, your answer to that question will be very different. So think about the economic impact specifically of COVID-19. We know people have not been able to work. There are people who've lost their jobs because companies haven't been viable because they're not able to open and function normally, and so they've lost revenues. And due to the policies that were put in place to keep people safe. But you also have people missing work because they are catching COVID-19 and they're sick. People are dying. We're talking about delaying opening of schools, online schooling. That all costs. If you take students from brick and mortar and you have them homeschool, a lot of schools have to develop the infrastructure in order to deliver online. Um, and that's something they hadn't had to do before. In order to do that, that's making sure all students can be properly educated with computers and tablets at home. And so, even though this is indirectly related, you can start to understand what the costs are associated with COVID-19. I don't know if we've even begun to even quantify the cost of COVID-19. When you think about the stimulus money that have went out to individuals, and how much that price tag was related to that, that's an economic impact. When you think of the research related to COVID-19 and the rush to get us find us a vaccine, there's a cost to that. Again, I'm hoping soon we will start having a better understanding what this price tag is going to look like, at least in the first several months of this. What the overall price tag will be another debate. But you can hear now, even in our in the political area, we have Democrats and Republicans not agreeing on the price tag. We also see where there are executive orders they're trying to be executed in order to move forward another stimulus package. There's questions about who needs the stimulus most. Are we funding big business? Or are we funding the individual families that are impacted by this? Are we focusing enough on financing health infrastructure and so forth? But anyway, you can get an understanding of what some of the controversies are related to public health. Individual liberty, we've seen this specifically also with COVID-19. Again, we can think broadly about other health issues, but again, as we're dealing with COVID-19, I think it's important to use that as illustration and examples for COVID-19 to help really drive these concepts from the textbook to you and help hopefully help improve your understanding. When we think of individual liberty related to public health, they're here even with COVID-19. Think about some of the individual liberties that people have about wearing a mask. Think about individual liberties that people feel that they need to push forward about working. There have been some businesses that have been cited for violating policies in their state for opening and continue to serve. There was a gym that stayed open. There were churches actually who continue to open and keep their congregations spiritual needs met. You have a lot of campaigning actually that was occurring as we were in the midst of a presidential election, where large group gatherings were still occurring. And a lot of this was fueled by people's individual liberties. And we've also seen news medias and we've seen news stories about people going into supermarkets without, and other places of business, stores and restaurants without refusing to wear a mask, feeling as though that their individual liberties are being infringed upon. But again, those are examples of how public health issues can develop um, controversies related to individual liberty. And then, of course, you have moral and religious oppositions related to public health. Um, One example is, churches who continue to open and gather in large groups, feelings and beliefs that, the people's spiritual needs supersede public health. But also sometimes a lot of our public health interventions, such as needle um, uh, needle exchanges, where people can provide use needles and get fresh needles to reduce HIV, AIDS, and other communicable diseases by blood. Um, that's controversial from a religious standpoint. People have beliefs about abstinence versus harm reduction in substance use, and their beliefs will inform that. Um, One of the worksheets or exercises that you were supposed to work on this week was thinking about your values and beliefs and how they align with the code of ethics and social values and beliefs. Harm reduction is one area. There's some people that may have personal and or spiritual beliefs about substance use and not support needle exchanges or other harm reduction actions. Another example is the distribution of condoms, perhaps, to keep unwanted pregnancies down, to reduce the exposure of HIV and AIDS. But you may have some moral and religious groups that oppose that. There are also other type of birth control measurements related to um, pro-choice um, and pro-life groups, which concerns with maternal child health, another public health area. And again, moral and religious groups may oppose some public health policies and interventions. Also, another source of controversy is political interference with science. And I think we've seen this a lot, specifically related to COVID-19 and others. You have a lot of political in maternal child health. You have a lot of, um, depending on whether you're a Republican or Democrat, strong views related to pro-choice and pro-life, and will seek to um, express those values and beliefs through funding of certain organizations, such as, or defunding of certain organizations, such as Planned Parenthood and so forth. An example with COVID-19, we've heard concerns about funding schools who choose not to reopen as normal, from political, and that's political pressures. And that may interfere with the science, especially when you have a public school system who may be wanting to take heed to the scientific CDC recommendations and of large group gatherings and being concerned about exposure and so forth. So we have seen where politics interfere with science. There was even a move by leadership of our government to remove the NIH and some CDC reporting from the overall data collection for COVID-19 infections. Again, these are all sources of controversy, but examples of how public health can be sources of controversy as well. Economic impact. Most public health measures have a negative economic impact on some segments. Some people feel there's chaos, there's money in chaos, in that there's people that they're going to benefit economically from public health issues and public health emergencies, and there are people that are going to be impacted negatively from it. Think about COVID-19 and some other types of public health issues and think about who are the winners economically. Some mask people who create and make masks, they may be winners economically. Think about grocery stores. It's one of the few places that people have been able to go consistently. And now with them shutting down restaurants, people, are cooking from home more regularly. So grocery stores economically are probably doing well. Think about hand sanitizer companies and so forth. Think about delivery services and so forth, and they're winners. Think about segments of our economy that are losing economically. Think of any social places, your bars, your restaurants, those places may be hurting more due to COVID-19. So again, most public health measures have a negative economic impact on at least some segment. Business often resists public health measures because they affect profits. We know we see examples of that with the restaurant industry, hotels too. It's not in their best interest when there's policies to prevent travel in tourist industry. There are also states actually that a lot of their revenues comes from tourism. Think about Florida, for instance. They were one of the states that really pushed back against any government interference with their normal course of business. And unfortunately, they are one of the, or at least one of the epicenters of the COVID-19 pandemic because of that. But again, that's an example of resisting public health measures to because you don't want it to affect profits. But there's a consequence to that, as we see. Those who must pay may not be the ones who benefit. That's the other thing. There are some people who are paying the price of lost income, less revenue, but they benefit the least too. So everyone that pays the cost for public health aren't necessarily the ones that benefit the most from those public health interventions and policies. Costs may be short term, while benefits may be long term. One thing about public health, we try to focus more on prevention and putting money up front to try to prevent either problems from occurring, public health problems from occurring, or for them getting worse. And there's this belief in public health that put the costs up front, short-term payments. You pay once for a short period of time, but the benefits will be met and will benefit populations for weeks, years, months, and years to come. But sometimes it's easier to calculate the cost than there are the benefits for the same reason. The costs are short term. You know if you spent $20,000, you know if you spent $20 million, you know if you spent $30 million, you can calculate how much was spent in a given period of time. But since benefits are long term, lasting years after the initial cost, it may be harder for us to really quantify the return on the investment from the original cost spent for public health measures. Tragedy of the common. It is exemplified in many environmental laws. Freedoms of individuals should be restricted for the well-being of the population. Do laws overly restrict freedoms to pollute? And what should be included among protected resources? So there are just this concerns about government involvement. When you think about public health, population health, it's a meso macro. So you're often looking at communities being affected, interventions that are impacting a geographical region, a larger region of people um, and populations. Oftentimes, state government and local, state, and federal government are oftentimes involved, and they're developing policies and laws to help address the concerns that we may have, specifically related to environmental laws, but not just that. We're also seeing a lot of that with COVID-19. And the concern is that when these policies and interventions are put in place in the best interest of public health, that individual freedoms may be restricted. Think about not being able to go outside, having to quarantine. When you go visit somebody out of state, you have to quarantine for 2 weeks. Some people may feel like their individual rights and freedoms are being infringed upon because of that. Again, being forced to wear a mask in the states that have mandated that. Do laws overly restrict freedom to pollute? Think about freedom to pollute the environment, but also freedom to restrict freedom to pollute in terms of an infectious disease. So it's not, we don't consider it polluting, but we do consider it transmission of a communicable disease. So think of it again broadly, in terms of environment, but also think about it in terms of disease management too. What should be included among protected resources? Think about, your values, your beliefs, what resources should be protected, which resources, should not be protected. And all these things are important when you're thinking about public health. When can government restrict individual freedom? And this is something I want you to reflect on in terms of what your values, your beliefs are. Also think about it as it relates specifically to different type of public health issues and specifically related to COVID-19. Restrictions to prevent harm to others is generally acceptable. I don't know. Normally we would think that there would be no concerns or no pushback when you think about government putting restrictions in place to prevent harming other people. But what one thing we're seeing specifically with COVID-19 is that it is not generally acceptable. That people do feel that restrictions in place, even if it is to prevent harm from others, is not okay. And we're seeing a lot of protests and individual people push back against that. Paternalism in terms of government restrictions and government oversight is only acceptable for laws concerning children, for protecting individuals from their own actions also. So there's also a thought that sometimes being more restrictive, showing more oversight with populations that generally don't have the rights that other people have, such as children, meaning children don't have the same rights as adults have. And think of also about protected populations, people who have had groups of people who had history of being marginalized or oppressed or abused or wronged. Sometimes there's this belief that government can act paternalistically when it comes to certain populations and generally too. Usually there's just a general acceptance of this. There's also a libertarian view, which has strong tradition in our United States history. Our liberties and fighting for that. There's always been a divide between conservatism and libertarians. We just need to understand their views and see how we individually and how we as social workers, where our views tend to be either a libertarian or more conservative. There's always been an argument for restrictions for the common good, but it also leaves a lot of room for controversy because there is no agreed upon understanding of what is the common good. And I think we see this with COVID-19, where some people even with COVID-19, thought there was just this general understanding that trying to keep people safe and healthy and reduce exposure was the quote unquote common good. But now we're seeing that again, there's it's controversy in that too. Again, moral and religious opposition, we talked about that. Concerns specifically around sex and reproduction, things about AIDS, STD, teenage pregnancy, low birth weight babies are major public health concerns. But then how do we address it? And what type of policies that you put in place to address HIV and AIDS? What type of health policies do you put in place to try to reduce exposure and prevalence of STDs and teenage pregnancy and low birth weight babies? And how do you enact those policies without upsetting moral and religious oppositions? Public health solutions are often viewed as promoting immoral behaviors. If you think about it, think about harm reduction, think about condoms, think about the different varieties of birth control. Alcohol and drugs, I talked about earlier, there's a concern related to harm reduction and whether it's promoting immoral use of substances and drugs. Such opposition may discourage scientists and funding agencies from conducting research on many important health problems. And one way that scientists are oftentimes discouraged is that sometimes funding is removed. Oftentimes, research funding tends to tend to flow in directions related to political party leadership. So, if you have conservative versus liberals in our government leadership, they can restrict funding for things that aren't aligned with those political values and beliefs. Politics versus science, there is always the possibility of tension, and I think we've seen tensions at its highest with COVID-19. Conservative control of federal government intensifies the conflict, which is what we are seeing today with COVID-19. Conservative party control of federal government, and then you see where that conflict and tension and pressure between um, um, the presidential president and leadership related to NIH and CDC. There was a criticism specifically of the Bush administration um, for going too far and misrepresenting science-supported support policies. Um, this was during the Bush administration, and CDC was administered to remove effective information from its website. The EPA, the Environmental Protection Agency, changed a section of a major report, and President's Council on Bioethics was controlled. So again, this was an example where the Bush administration, due to their political values and views, had ordered the CDC to remove information from its website that they felt wasn't contradicted or didn't align with their political views. Also, EPA was directed to change a section of their report because it didn't align with the Bush administration, and specifically the President's Council on Bioethics was also controlled. And we see this again with COVID-19 as well. The Obama administration made efforts to inform policy decision based on honest science. So let's think about discussion questions. Do you agree that the philosophy of social justice is preferable to the philosophy of market justice? Think about your personal values and beliefs when you're thinking about an answer to this question. Also think about the social work code of ethics and how it would inform your answer to this question as well. Which is likely to lead to greater improvements in public health? Social justice philosophy or a market justice philosophy? Give an example of a measure that would benefit public health but that might be expensive to implement. Who would benefit? Who would pay the cost? And think about it related to COVID-19. You know that's a relevant current public health issue. You know what? Give an example of a measure that would benefit public health as it relates to COVID-19, but you know would be expensive to implement, right? And once you have a good idea what that measure would be, consider who would benefit from it, who wouldn't benefit from it, who would be the ones who would benefit and the ones who would not benefit, and are the ones that are not benefiting, how much of are how much are they on the hook for that price tag, and who would pay the cost? Discussion question 3. Give an example of a measure that would improve public health, but that might limit some people's freedom. Who would benefit? Whose freedom would be limited? Again, I provided some examples in this video, but I want you to critically think about other types of measures that would improve public health that might limit freedom as it relates to COVID-19 or any other public health issue. How far do you believe government should go in advocating or enforcing moral behavior? Again, we see this a lot with COVID-19, where a lot of college students have been warned about partying on campuses. There have been people caught gathering in their homes, actually having parties, and they're being cited for that. You know, do you think that's going too far? Do you think that the government has the right to enforce people on whether they can leave their house, where they can go? Do they have a right to tell stores to close, restaurants not to open, people not to gather publicly? Do they have a right to do that, particularly related to public health? Again, think about your personal values, your religious values. Think about your social work code of ethics values as well. That's will conclude this chapter, but I want you to continue to think about those key themes for this chapter.